There'll be quite a few permanent changes made after the COVID-19 pandemic passes. We've already had some temporary changes that have been made as a result of governors realizing there have been too many restrictions on pharmacists. For example, they're authorizing pharmacists to refill prescriptions without physician permission. They're authorizing pharmacists to perform diagnostic tests that previously they could not perform. They're removing some other restrictions, like pickup kiosks are being authorized to eliminate person-to-person contact, emergency dispensing of Schedule II medications without contacting your physician. Many of these temporary changes are going to become permanent. We're going to have a new normal that will be impacting all of us and all the ways we live, and pharmacy will be part of this new normal. For example, pharmacists are going to be heavily involved in vaccinations, immunizing people to COVID-19 and other coronaviruses. There'll be between 200 million and 500 million vaccinations. Pharmacists will have to be part of that. Diagnostic tests. Pharmacists will be performing diagnostic tests in the pharmacy, and they will be authorized to treat the diseases that they diagnose with cocktails of antiviral drugs that are available right there at the pharmacy. Rationing. Pharmacists are going to have to make sure that the people who need these medications first get them first. And the people for whom it's not quite as critical that they receive them have to wait a little while before they have access to them. Automation. Pharmacists are going to have to introduce kiosks and other ways of providing people the medication they need without person-to-person contact. We just can't have as much human contact in pharmacy in the future as we've had in the past. Then refill clinics. Pharmacists can authorize patients to get a routine refill without the patient having to go into the doctor's office, sit in a chair next to somebody who probably has a communicable disease, go see a healthcare provider who may also be carrying that disease. There's no need for that. And lastly, we're going to change the way the PBMs do the business. They're requiring prior authorization and other things of pharmacists that need not occur. We can change that. All of this, I'm looking forward to covering in the Pharmacy Law CE Library. This is the place you can go to get updates on pharmacy law, to find out your responsibilities under the law. And you get to earn continuing education credit as you learn these important aspects of your legal responsibilities.